to give a short overview of community-based participatory research, or what's also known as CBPR. And some people like to refer to this as community-engaged research. Regardless of name, this is an important framework to consider for advocacy community health efforts. So first, I'd like to ask you, when you're working or doing research with vulnerable populations, what can be difficult? Some of the things that people often mention here are trust, gaining trust with a particular population because of the legacy of distrust that science and even clinical care have been approached. Others talk about longevity or maintaining contact because, as we know, many vulnerable populations are moving or they don't have consistent access to cell phones or they change phone numbers, etc. And so it can be very, very difficult to work with vulnerable populations. And so the idea behind community-based participatory research or community-engaged research is that we have to have ways that we can partner with people to work on things that are important to them. So I've pulled up a slide that has become really important to me in thinking about this idea of CBPR. This is from an artist, Nina Cacciadorian, and this is from some work she did called the Mended Spiderweb series. And Nina really was well-intentioned. She wanted to help the spiders, and at her home she found abandoned webs or broken webs. And she went in, she prepared a very special toolkit. She had tweezers, she had special red thread, she created a non-toxic glue to hold this together, and she went in and painstakingly repaired the abandoned and broken webs for the spiders. Now, what do you think happened when the spiders returned? Most people guess that maybe the spiders didn't like the webs, but in fact, they really didn't like the webs. They ripped down her repairs and respun all the webs, even the abandoned ones, with their own efforts. And I think this is a really important lesson for us in the work that we do, especially with vulnerable populations. When we go in to communities or with vulnerable populations, we're well-intentioned. We want to do the right thing. But often they've been struggling and working to make things work in their own way, and our efforts are not welcome. And so we often come back scratching our head or asking, why didn't the evidence-based strategy I'm using, why did it not work? So this has become important to me for thinking about the work that I do in health disparities and health equity. Here's another saying that I think is important to think about as we're considering our efforts, whether it's research or interventions with communities. We also know that there are many contextual factors related to health, and here are just a few of the related factors. There are many others. And the other thing that's important to consider as we think about CBPR and as I introduce this framework to you is the continuum of community engagement. And so here we have a pretty simple graph that shows little cooperation on the left-hand side up to partnership, a very scientific a lot there. And that's where CBPR and community-engaged research falls. Here's the definition, the formal definition of CBPR from the Kellogg Foundation. The Kellogg Foundation actually has a clinical scholars program for physicians that focuses on CBPR. But you'll see the important part of the definition here. Collaborative, equitably involving all the partners, beginning with a research topic of importance to the community, and working towards social change. Now, it's a little confusing with the term CBPR because the word research is in the title. It not only can be used as an approach to research, but it also can fit intervention, education, planning, efforts, and can be used across the board. It is a framework or an approach to these efforts, and it does not necessarily dictate what kind of method you use. So you could, for example, use quantitative methods, qualitative methods, or mixed methods as you're working. Now, in the Western world, we tend to view CBPR as the term that we use around health-related matters. When I'm across the street at UC, for example, we tend to talk more about participatory action research or action research, but meaning very similar things. CBPR has gained ground from a lot of different foundations. The Institute of Medicine has included CBPR now twice as one of the areas that schools of public health must include in their curricula. And here's another way to think about the CBPR research process. I like to show this because the middle arrow really shows all the steps of any research project or any effort that you would be thinking about, figuring out what you're going to look at, designing and conducting the research or the intervention, looking at, interpreting, analyzing the data, and then disseminating results and figuring out next steps. And that is true of CBPR as well. It's just that the community partners and the academic partners are working together. Here's another continuum to consider. The terms CBPR and especially community engagement have become very popular, especially in academic medicine. And I think it's really important to call out the distinction between going into a community-placed work versus community-based participatory, where you're sharing and partnering with folks throughout the process. Here's a look at comparing CBPR to traditional research approaches. And so why should we do this? One reason is that the communities that we often work with are really tired of feeling taken advantage of. They don't have a lot of trust in our efforts. And you're much more likely to get buy-in from community members if they're part of the process. The example I always like to give is there was a study conducted in a low-income neighborhood in Atlanta where peer researchers or neighbors in that community went out and asked other neighbors and folks living in that community what their biggest health need was. And all the researchers were pretty clear that they knew the answer because of all the health reports and some of the high-risk factors that were part of that community, violence, teen pregnancy, etc. And when they looked at the results, what came back is the most important health need for that community was actually streetlights. And so again, why would streetlights be such an important health issue? Related to safety, related to being able to exercise outside. The community did not feel safe doing that. And so if you're partnering with that particular community or neighborhood, it's not going to be very effective to go in with an asthma reduction program if the top health need according to the community is streetlights. And so it's figuring out a way to partner with them to work together to address priorities for themselves, and then also potentially over time building that relationship so that whatever your research interest or your program could then become part of that community. The results of using CBPR are impressive, and some of these are listed here. But again, I think one of the most impressive for me is the idea of buy-in and the fact that when people are involved in a process directly, they are much more likely to benefit from it, and they're much more likely to be able to act on that particular issue. Here are the stages of CBPR. If you're doing a full-blown long-term partnership, I won't go into detail about these, but I think what you'll see is the importance of forming a partnership and maintaining that partnership. And then you're really following traditional models of figuring out what's important to look at and then doing the research or the intervention, interpreting the findings and disseminating those findings. The other thing that might be a little different with CBPR is that as you're considering a needs assessment, you're also looking at strengths and resources that already exist so that it is an asset-based approach in addition to identifying barriers and challenges. Barbara Israel, who's really a guru of CBPR, identifies 4 areas that work really well with a CBPR framework. And I'll just mention a few of my favorite examples. Probably the most compelling are the idea of using community resident research teams or partnering with community resident research teams who really become the researchers in their own communities. The most recent example, for about the last 3 years, I've been working with a team of Latino immigrant researchers. They named themselves Latinos Unidos por la Salud, or Luz Salud. And we formed this partnership with the Latino immigrant community because of the drastic growth and change of Latino immigrants in our area. And we don't know, even at a basic level, what the healthcare needs of this population are. And we certainly don't have the infrastructure in this non-traditional migration area to address their needs. So for the past probably about 10 years, this Latino immigrant population, many of whom are undocumented, have basically been hidden. And so a colleague and I knew that the only way to find out what was going on within this community for children and families is to partner directly with them. And so these are some other work that we had done, but we know that immigrant Latinos have lower skills in the healthcare arena compared to other groups. And there are many data collection challenges and issues around engagement of Latino immigrants in our community. This is Sheriff Jones up in Butler County, and he's just one example of what creates a very anti-immigrant sentiment in our geographic area. And so here's the team, Lou Salud, the initial team, and this group worked together to co-create a survey that was verbally administered to other Latino immigrants in the community. And then we worked together really to figure out how best to address and what questions to ask around the Latino community in terms of health for children and adults and families. Here's another bounded project that where we worked with the Black faith community, members of the Black faith community, to figure out how to address HIV/AIDS and the stigma associated with that in their church communities. And I'll just briefly mention that we used a methodology called concept mapping, which is a participatory strategy that gets a lot of different stakeholders involved. And so in this case, we were working with this Black faith community, not in a long-term fashion like we have with Latino immigrants, because now with the Latino immigrants, for example, we've gone through a second phase of work together, and now we're in a third phase where we're working together to do an intervention with the community. In this concept mapping project with the Black faith community, this really was bounded and meant to generate ideas that each of the individual churches could use to make their own action plans. So we were still able to use some of the values and stance of CBPR, but then work toward a final end so that they could use the materials and the ideas themselves. And this is just comparing some of their different groups and how they looked at the strategies that they came up with. We have a youth advisory council for suicide prevention who are conducting, as local high school teenagers, they're conducting their own research projects in collaboration with several academics. A long-term partnership with a local school, and there's been all sorts of programs and research projects through that partnership. Health needs assessment at the school, program with girls action teams that we were able to do. And it was through that long-term partnership that these things work. We've partnered, colleagues and I partnered with health and wellness coalitions in different areas to work on projects together. This was a grant that the group out in Adams County obtained to put in a fitness trail. We have gathered data at health fairs because, again, we want to go to people and work within their communities. We'll mention Photo Voice a little bit later, but it's a great strategy that allows people to document their lives and communities using cameras. And we'll finally end with this particular case, and I'll ask you to read the case and think about if this is truly CBPR. What are the pros of this particular case and what are the cons? And then how could it be different if a CBPR approach was utilized? So I'll give you just a few minutes to read this and then think about the questions that I just mentioned. What are the pros of this particular case? What are the cons? And how could CBPR be utilized to make this different?